So I'm going to start by sort of describing what's happening in the United States compared to what's happening in Taiwan. Taiwan has done an excellent job in containing the virus. And so the initial efforts trying to delay the introduction and spread of the disease into the community really worked. And also the contact tracing of those who has been in close contact to COVID-19 patients was done extremely well. And so it really had kept Taiwan in sort of this lower part of the curve compared to the United States. In the US, we started with pretty much community spread because people, a lot of people thought it was a flu. And so states were not prepared for it. I think the federal government in the United States were not really preparing for it as well. And so when you start with community spread, mitigation strategy is really necessary. And that means in order to minimize the mobility and associated mortality, you have to do things like shelter in place. So right now I'm staying home. I've been staying home for close to 2 months now, except when I go to clinic to see patients. Otherwise, I'm back home. And so the reason we ask people to stay home is because we want to avoid the surge in the hospital volume. That could really overwhelm the healthcare system here in the United States. And however, we at some point have to open up, and we're right now trying to think, how do we open up safely so that some businesses could get back to, operations. And so while we're doing this sort of social distancing, non-pharmaceutical interventions, everybody is sort of waiting for the development of therapeutics and vaccine. So let me just show you this curve. You probably have seen this before. So if we don't do any intervention, there's going to be a surge. That's the red line. Now, if we do some social distancing, but we don't do it really well, it's the green line. But that basically will hold the hospital volume at a certain level. But if we do it really well, it's the blue line, where you could keep it low. But at some point, we're at the junction where we're trying to figure out when to lift it and how to lift it, and the risk of resurgence following the lifting of interventions. So this is where we are in the U.S. And so I think when you're trying to think about creating solutions for COVID-19, you have to think about sort of the context. So in Taiwan, because a lot of the contact tracing and quarantines are done very well and by the government. So pretty much the private sector don't have to worry about it. The individual counties and local government basically work very closely this time with the central government. But I'd like to take you back to this roadmap of where some of the opportunities are if you were to develop solutions for the United States. So we start with symptoms. So when I see a patient and in the clinic, you assess the symptoms and signs. And so I think for COVID-19, there's a lot of different symptoms now that we know, like cough, shortness of breath, in some cases, loss of smell and taste, chills, headache, sore throat, muscle pain, and more recently, skin conditions. So it is turning out to be sort of a multi-organ, multi-system disease, and definitely fever is seen in many patients with COVID-19. So we have to ask the question, so if we're seeing these symptoms, where are we in the course of illness? And how much viral load is there? If we're seeing a patient with very mild symptoms, or maybe they have, no symptoms, and how do people differ in terms of symptoms and why do they differ. And I think the previous speaker, Dr. Zhuang, had alluded that there may be some genetic variations in how people are sort of susceptible to this illness. And so when we think about sort of ordering a test, we think about sampling. Well, when you order a test, and I don't know, sort of, in Taiwan, probably the National Health Command Center and the health department work together to make sure that the tests are ordered correctly. But in the U.S., it's distributed. So you could order a test from any clinic. Sometimes you go to a lab directly to order a test. And so when you order the test, the reporting is more difficult because the test needs to get ordered. And then you need to collect a sample. And there are now a lot of evidence that about 60 to 75% of the swab collected are actually successful. That means about 30% to 40%. There's not enough material to even run a test. So that's problematic. So, if you get a negative test, it could be that because you didn't get a good sample. And then you have to worry about the route in which you collect the sample. So are you doing a nasopharyngeal, which is actually very painful sometimes, or you're doing just a nostril swab, or you're doing the oral sampling? And I know that there's also some discussion about, fecal material, but I don't think that's common. But you have to think about the route in which you get it, and then you have to transport it. So if you order it in a clinic, you might need to transport it to a lab. And so all these are steps that I think in the US is quite common, that sometimes the sample will get lost. Sometimes that it's not properly reported to the health department. And so approximately 70 to 80% of the tests are actually reported to the health department. So there's one more step. So there's the sample collection that could be missing, and then there's the reporting to the health department that could be missing. And then you have to worry about where in the course of illness that you're collecting the sample. And you have to worry about the safety and handling of the sample because it's COVID-19. So when you're trying to create a solution for the United States, you have to think about all these steps. How will people use your equipment? How will people use your test in order to have adoption, right? Because that's all got to get figured out. And then when we think about the test, there's the RT-PCR, there's the antigen test for the virus. And every test has its sensitivity, specificity, the cost of doing the test, and the time it takes to do the test. So when states are reporting things like, how many cases, there's no reporting of the sensitivity and specificity of the test that they're reporting. So they only give you positive or negative, which, in some cases, if you have, a false negative of 15%, that means you're picking up only 85% of those people who have the disease. So that's also very dramatic. So when you read the newspaper, it's really hard to make sense of what is happening. And then there's the triage, right? So you order a test, the patient tests positive. So you have to do isolation of the patient. And then, then the insurance company comes in. I mean, somebody has to pay for this. And if the patient is hospitalized, you need to actually talk to the insurance company. And then in some cases, for context, you need to home quarantine, and sometimes it's in a hospital, sometimes it's at home. And it's really difficult to follow up on people who are under quarantine in the United States, because you can't just go into people's homes. Some people's homes are gone. You can't go in there. So then how do you do contact tracing? That's even harder because the United States does not have a household registration like Taiwan. So Taiwan 有里长, right？ 然后也有区长，那大家都住得很近，right？ So you have to, it's easier to deploy human contact tracers, but in the U.S. you almost have to rely on some sort of technology to trace contact tracing with the human, right? Together, how do you work together? How do you create integrated system that the human contact tracers use to follow people? And then there's the viral load issue. So they say somebody recovered, and is this person still infected? How long do you follow them? You know, when does the infectious period end? When is it safe to release the person? And then does that mean the person has immunity? So you know, people talk about antibody tests like IgG and IgM. Does that confer immunity? And so all these things are just, you know, understanding of diagnosing the patient and managing the patient, right? We haven't even thought about treating the patient. So they say a lot of you are interested in developing therapies. Well, I think first and foremost, it has to be safe. So you can't harm people when you have a vaccine that's going to be delivered to healthy people, right? Because a lot of young people, when they get the virus, they're actually fairly okay. They don't have severe symptoms. Only 2 to 4% have severe symptoms if you're young. So if you give a vaccine that actually hurts the person, that would not be good. And is the vaccine efficacious? Given there are so many different strains of the virus, you know, and you're developing a vaccine target, how do you ensure that it's efficacious for most of the viral strain, which could be difficult because we have trouble even getting the flu correctly, right? And then there's the delivery method. So they say you have a vaccine and you want to deliver it. Well, is that a shot? Or is that something oral? Or is that something nasal? And so all these modalities of delivering a vaccine have its associated cost. How much people afford? And then there's the issue of time to market. Some vaccines take longer to get to the market. And the cost and the production, can you scale with the production of your vaccine? And also, something that entrepreneurs often forget is the distribution channel. How do you make sure that you have the right distribution channel? If you have a therapy or if you have a vaccine. So all these are opportunities for entrepreneurs in Taiwan, but also they are all challenges because you're not really familiar with the delivery of healthcare in the United States, and you should probably partner with people who are. That could get you there a little bit faster. Now, if your market is not in the United States and you're in Southeast Asia, same thing. I think you have to understand the structure and the infrastructure of the country that you're going into and the regulations, of course. So this is actually my last slide, and I want to spend a little bit of time on this. So when we think about solving problems, and in this case, you know, COVID-19 covers a wide range of issues. We start with the science because our understanding of science is going to dramatically change what we do and the policies associated with what we do, right? So when you think about the science, and I'm just going to take one example. If you ask the question, how much viral load matters for infectivity and how much exposure is required, right? So this is the question you might want to ask if you want to try to reopen America or elsewhere. And you might want to be able to monitor that when you get people off quarantine or self-isolation. And then if you look, what do we do? You know, how do you design proper experiments to do this? Or are there any useful data sets that you could help to answer this question? And some of the experiments are not ethical to do. Like you can't expose humans to another human with COVID-19. That's unethical. And then how long would it take to answer the questions? And what are the sources of funding? And how should governments fund this type of research? And then in practice, if you ask the question, how many different types of tests are out there? How do they differ by sensitivity, specificity, cost, and time? You have to have a benchmark on doing that. And you could also do the same for vaccine, and you could do comparative effectiveness studies comparing one vaccine to another simultaneously. Not every single vaccine manufacturer needs to have its own experiment. You could do like 2 or 3 or 4 together, so it's faster. And you compare the relative effectiveness, the relative sensitivity, specificity. In this case, is the test, but you can also compare vaccines for effectiveness. And then, what do? How do you design a strategy to compare different tests with positive and negative findings? So if I'm a state that uses test A, then you are a state that uses test B, and you're telling me your positive rate is 80%. Like you have, and my sensitivity is only 70%. So for the people that I'm calling positive, I'm missing 30%. Right? So that's very different. So you have to be able to compare apple to apple. And then, what's the supply chain look like if you develop a test, right? And what are the materials you need for testing? Like, in many states in the U.S., we're missing swab to collect the sample. That's the very basic. Not even the test, the swab. And so you have to get the supply chain going, make sure you have the materials. And then when we look at delivery, how do we do contact tracing and follow-up care in a massive scale in a place like the United States, where there are no household registration? And you have different health departments, and you have different states. State has its own regulation and reporting system. So how do you build an integrated system that everybody could do plug and play? And then how do you develop an integrated technology package? Let's say in Taiwan could develop an integrated technology package. So each state just adapt it quickly with, digital plus human contact tracer. That would be wonderful. And then, if you have different teams, how do you integrate the technology developed by different companies into an integrated secure platform? So, health departments and states are not going to help you integrate your technology. That's not what they're good at. They don't have time for that. And so you need to think very carefully when trying to develop a system like that. So with that, I could answer some questions if we have time.
Hello. I heard that CDC director has announced that he would send out 650 experts to all states to help contact tracing. So how would they be doing that? Do you know anything about that?
Yeah, just California alone, we need 10,000 contact tracers. Just California. The United States will probably need 100,000 contact tracers. Just in Massachusetts, in Boston, they hire 1,000. So, 600, you could help to train people how to do contact tracing. So those are probably the trainers. But those numbers are not enough at all. I mean, you need to teach people who do this very quickly. And we're facing with a virus that spreads very quickly. So human contact tracers, by the time you do the interviews and you try to figure out who the person has been in contact with, that takes days. And that's after you know who it is. So, even the test, when somebody orders a test, by the time the health departments find out who's positive, that's several days. So that's a real problem.
Yeah, my question is, it's already in the community, the virus. So is it a bit too late to do that? And the work will be so massive. That's really my question.
Yeah, so you're right. So the question is, let's say we'll be doing social distancing for a while, shelter in place, right? So the spread of virus in California has slowed down, at least in some parts of California, really slowed down. So the idea is that if you try to reopen the economy and take some people back to work, you still need contact tracers. Like you need to be able to follow people if they get it, so that they don't infect other people in the work. So you still need that. And the work is massive.
那我请。
Hi, Dr. Wang. I'm Dr. Suti Cho. I'm the former commissioner of Taipei City Health Department when SARS attacked Taipei. I would like to share with you about how Taiwan did contact tracing. Actually, it's not by the Li Zhang or any layperson. Actually, it's by public health workers. So they directly ask the patients whom they had close contact with. That's number one. Number two, when the patients have been to some public places, I think they even try to locate those footprints. Sometimes perhaps also by their cell phone. Yeah. And then, as you know, that the government shared, in case necessary, they shared the footprints of certain cases with the public, and they sent out the, how do you call it, 细胞广播, to people who might have been to those places. Yeah. But I'm really curious about how US is going to reopen. Yeah. Sounds quite terrifying that if you cannot make sure how many active cases there still be, then it's quite, to some extent, I will feel it's quite dangerous.
Yeah, thank you. And you know, I know that Taiwan has an incredible public health system with a lot of public nurses and people who work in the Department of Health, all wonderful, highly trained individuals that do contact tracing. I think the point I was trying to make is that it's easier to find people in Taiwan because of the household registration. But I understand that the contact tracing is being done by public health officials. And it is an enormous task to reopen America. And we're working with 3 different groups right now, trying to create the model and the calculator to help governors do that, and also to help mayors do that. So we're in the process of working on it.